Oliver Kohlbacher is a professor of bioinformatics at the University of Tübingen, where he has been very active, and he has been the director of various institutes there concerned with bioinformatics and also translational research in bioinformatics and medicine. And he is also one of the GHGA directors. And in that role, he will now give us an overview of what GHGA has reached so far, the journey up to now.
Thank you, Susanne. It's my pleasure to present the work of, well, so many people here in the room over the last 3 years. And listening to Augusto, to Søren, makes me want to cry in some cases, and really jealous to some extent. But I think we're on a good way forward. And today I'd like to summarize how far we have gotten. So when Ollie and I started discussing this whole idea, okay, better? Okay. When we started discussing the idea, the starting point was that we thought that Germany was actually quite active in some of the research projects in genomics and also in bringing genomics into healthcare. But we did not have a national infrastructure for archiving and sharing genomics data. And with all the discussion that we had about GDPR, data protection, this was sorely missed in many cases. So we decided to build such an infrastructure, which turned out to be GHGA then, in order to close this gap between research and healthcare. What the heck? Okay, that's funny. Not what I put there on the slide. Let me put it like that. So we wanted to establish such a national infrastructure, and it was a good opportunity when there was a call for the National Research Data Infrastructures, NFDI, in Germany, quite a large-scale initiative funded with 900 million euros for 10 years. And we were lucky enough that we were selected as one of the 9 consortia of the first round, and that's no small thanks to all of the PIs who also supported this, to chip in, who also contribute infrastructure, because funnily this is a data research infrastructure initiative that does not fund infrastructure, but yeah, that's the way it goes. So this consortium started working in October 2020. We are quite a few institutions, universities, Helmholtz Institution, other research institutions, 21 altogether. And in this network, there are 7 so-called data hubs, and we will get to this issue of data hubs in a second, that were initially chosen to be physically close to the major sequencing centers in Germany. Germany has quite a few academic sequencing centers, and we thought we leave the data where it is. We don't transmit it unnecessarily. And at these sites, we also had cloud infrastructures that we can connect to, namely the Denby Cloud. In GHGA, we have a board of directors, and that's Olli Stegler, Jan Korbel, Eva Winkler, and myself. And we have been trying to keep this consortium together and on track in recent years. So what does GHGA store? So it's not all about genomes. We have this unwieldy name, German Human Genome-Phenome Archive. So as Søren pointed out, it is not just about the genome, it's also about the other data that goes with it. So we store also related data, transcriptome data, proteome data, but also associated clinical phenotype data as long as we get access to it. This connection is critical in many ways. It has implications for data protection because it is not directly anonymizable. Once you anonymize the genome, it basically loses its value. And we wanted to start in the areas that also have popped up in other presentations. oncology and rare diseases are sort of the poster childs for genomic medicine, and that is why this was where our focus is. We will certainly grow into other areas as we get to that, but this is where we also got money for first. GHGA does not live all by itself. It's part of a European ecosystem, but also a national ecosystem. Within GHGA, we have close connections to the disease-related communities, and by that I mean primarily research communities, but also patients, of course. We need to work closely with the standardizing initiatives, the Global Alliance, but also Elixir, the other research data infrastructures within Germany. We need to reach out to the use and access committees. We need to have a technical infrastructure. And of course, we need to connect to our European counterparts. And that's a very complex task. We have many moving parts in this project, both on the political, on the legal, and also on the technical side. So how far have we gotten in this process? So after we had written this proposal, very nice grant prose, we were proud of it at the time. We figured in order to make that happen, we need to organize ourselves a bit differently. And that is where why we split the work into 8 work streams. One on architecture, that is basically developing the technical conceiving and implementing the technical infrastructure. One on the data hubs, operations and data stewardship. Then the metadata that goes along with that, workflows that we need to process it. ELSI is probably currently the most important work stream that we really started with, because that's the foundation for everything we may do. Then training, outreach, and project management. And I'll show you some of the results of this first funding period. In the ELSI workstream, we early on engaged with patients. There is a Pagoda study that was looking into the view of patients on governance structure of databases, including genomic databases. That has come out. Then we have a white paper on consent modules. We had lengthy discussion of what should patients consent, what do patients need to consent to in order to make that happen. A long discussion. We now have a suggestion on consent modules that are compatible with GHGA. We have a code of conduct and also a major achievement, a legal concept that describes how the infrastructure connects to all the other stakeholders. Our outreach team was also very busy. We came up with a communication strategy. We branded GHGA and tried to publicize it in Germany. We have a successful public outreach campaign that also started a podcast on all things related to genomic medicine. We contribute to a number of conferences, have lecture series, webinar series. And those of you who have not yet subscribed to our podcast, it's in German, but today we have a new episode coming out on rare disease diagnosis. So if you have not subscribed, that might be interesting to do. The training work stream has set up the main webinar series where we have GHGA specific topics on metadata, consent workflows, etc., but also overarching topics. How do you manage data? How to make it fair? How to make it reproducible? I really don't know what messed up my text there. Never seen that before. And we have a couple of workshops in particular at conferences where we try to train people before we actually are in operation, so that by the time we get operational, they will be able to submit their data. We also have these materials online, so people can read up on that, on GHGA related topics, for example, data protection. Then we have been preparing the data hubs that have been contributing infrastructure for the operations. As you know, we have a federated structure for various reasons. I'll get into that in a second. But basically, these data hubs provide object storage that allows us to route the data from the local sequencing center into a data hub. where it's being staged and ingested. And then there's GHGA Central, which is here in Heidelberg, which has always the data on the, or the metadata on the data that's present at the data hubs. And that is where also the central access to all this data is hosted. So we have a website through which you could find and access that. We also started preparing the procedures on how to do the data ingest, but also data access. That's our data stewardship team that is distributed across these data hubs as well. Okay. Not what I wrote there. Work streams. So the work streams team has been working on providing national reference work streams for short read variant calling, germline and somatic, long read sequencing, RNA-seq, and also tried to build a community around those and start benchmarking across sites. The metadata workstream started initially with the EGA model, but we found that the EGA metadata model, as it was at the time, was not entirely suitable to what we wanted to do. So they have been very busy building a metadata schema that captures at least the core metadata for GHGA, and that has been used both for the metadata catalog, but also in preparation of the archive data ingest, and that is all publicly available. There's also a white paper on that in case you're interested. We also thought initially we can take on quite a few software tools from other initiatives, but for various reasons, we decided that we need to develop at least the core components ourselves. So the architecture team has been very busy developing a microservice-based infrastructure that's infrastructure agnostic, so that we can also change this infrastructure as we go along. Focus on code reusability and also compliance with existing standards, in particular the Global Alliance for Genomics and Health. All of that's available as open source software. We also have internal guidelines to develop a cookbook on how to do that. And with this infrastructure that we've designed, we're now approaching operations of the archive. So how far are we? What can you see? If you navigate to GHGA.de right now, then you will see the catalog online. The catalog is the first of 4 phases. It's a metadata catalog, so you cannot download the data directly from there, but you can discover the data. That's the first operational phase that we have achieved a few months back. We now have more than 3,000 genomes in there that you can navigate, that you can explore, and people have used that to actually exchange data, except that now you have to reach the owner of the data, the controller of the data directly. What's upcoming now, and you will see that in a minute how it looks like, is the GHGA archive. That is basically the complete EGA functionality on a national level, central infrastructure for data access, unified ethical legal framework, and harmonized metadata. And as we move forward, we will also implement the cloud phase, where we have a secure processing environment, and then the GHGA Atlas, where we'll have more community curated data available there as well. So if you go to the catalog now, you can browse this metadata, different studies. It's very similar to what you would see in EGA, except that the web interface is more beautiful. So when we look at that, you can see the different studies. You can open that up. You can navigate in there. You can go to the details of the data set, the study, the project description, the publications, and you can also access the information on the data controller. And from there on, you can request the information. But GHGA is currently not the infrastructure that provides you access to the data. That will be only provided in archive. Right now, we just tell you where to get the data. As we move forward to archive, we will actually make use of this federated structure. And you can ask why a federated structure that comes with quite some overhead, but we had big sequencing centers that were spread out in Germany. We had a federal data protection officer that required federated storage. And we also did not have the hardware, we couldn't fund it, and we did not have sufficient capacities in one place. So that was the only option that we had. And some of that is hosted by the Denby Cloud infrastructure. So we have, when we're done, around 7 data hubs that will provide these services, currently storage. Now, when you look at archive, then you can actually request access there. So there's an additional button. Otherwise, it looks very similar to the metadata navigation. You can request the data, and what the data steward then sees in their end of the portal, basically on the other end, is they see that a new request has been received. So every data steward can look at pending projects, search for the project, and once the data access committee has granted access, they can simply, through this web interface, grant access to the data. This archive phase is currently not in production. What you see right now is only the metadata catalog, but you can see technically we are already there. We now need to get a few contracts signed so that we're also legally there. And once that has been achieved, hopefully early next year, we will have the full functionality operation. So how are we embedded in Europe? Apologies for that. I don't know what happened there. We face the situation that we have a double federation. Now we are one central node in Europe in this federated European Genome-Phenome archive, and we are again a federation of data hubs. And that adds to our complexity in the implementation and has slowed us down a bit. But we hope that since all these services are centralized in GHGA Central, logically, people will not actually notice the difference between our federated EGA node and others. That's why we're also part of GDI. We are the German node in federated EGA and GDI. All these projects try to harmonize this infrastructure. Most of the European countries, as you have seen right now, are building national nodes and have been doing so independently. And we early on decided that we need to go forward in this way and then to harmonize once we have established infrastructures for various reasons. Because the complexity of setting up this national node is already big enough. If we would do that in a harmonized manner right now, we simply would take too much time to get it up and running. So as we move forward, we also had to change our goals a bit. So what happened in the last few years was that there was a plan for a national genome project, Genome-DE, with a mission to integrate genome sequencing into the routine care of patients, first of all in rare disease and cancer, and second, to design a pilot project that would demonstrate these benefits in healthcare. And that is what we did. This pilot project, model project, is supposed to start early next year, and GHGA has been contributing to this model project. Starting next sometime, hopefully in first quarter of 2024, the statutory health insurance in Germany will have to reimburse genomic sequencing for rare disease and cancer if the patients are included in this model project. It's currently limited to university hospitals. 21 university hospitals are currently participating. It might be 30 by the end of the year. And the reimbursement of the cases requires data deposition. Currently, it's planned to do that within 4 weeks. Both of the genomic raw data, of the clinical documentation, and of the digital representation of the informed consent. And that will be a game changer for the way we do genomic medicine in Germany. As we ramp this up, we hope that after 3-4 years, we will reach about 60,000 genomes per year in this model project. It can very well be, just like Søren said, that we will not get the 60,000 genomes. I think that is highly likely for various reasons, but it's a good goal. And if that happens, and if GHGA really gets confirmed as the infrastructure to store that data, because again, in this project, there's no money for infrastructure. then that means we will have to ramp up our efforts as well, because that alone will give us roughly 250,000 genomes over the course of the model project. GHGA has been in discussion with many other international and national activities, the national cohort, the National Decade Against Cancer, SolveRD, and all of these projects are planning to deposit data at GHGA. So I think we're well set up. And if all of these projects really materialize and sequence their data, then GHGA will have to deal with 500,000 genomes over the next 5 years. So we have our work cut out for us, and we will certainly have to find additional funding to ramp it up to that level. But I think right now it's looking good. We're not just building an infrastructure that will be empty, but we will actually be an infrastructure that will be struggling to deal with the data that shows up, and that's a good thing. So how are we heading? Where are we heading there? So GHGA archive should be operational early next year. We're working on the final contractual issues. The data hubs have already started to store the genomic raw data, transferring it, but currently outside of the legal framework of GHGA. Once we achieve this operational status, we will just need to change the metadata to point to the data. We are also thinking about the GHGA cloud. How can we set up secure processing environments suitable and allowed for person-related data by the data protection officers? That is a discussion we are currently having. And we are spending a lot of time and effort on getting this German Genome Initiative and the model project up and running, but that's also a large opportunity for us, because if we can be part of that, we can actually show that we can make a difference, not just in research, but also in healthcare. I'm just standing here to talk about that on behalf of the tremendous team that you see here in the photo. We are really, really happy to have these people on board. It has been a challenging trip so far, these first 3 years. But I'm really grateful for everyone who chipped in. I think we have come a long way. We are not where we would like to be, but I think we're now in a situation where we will be productive in a very short time, and that is due to this excellent team. So thanks a lot for that, and thank you for your attention.